Hello class, my name is Riley Malfris. Today I'll be talking to you about thyroid preparations. In this pharmacology class we have two different types of drugs. We have drugs that treat hyperthyroidism, known as PTU and methimazole, and we have drugs that treat hypothyroidism, such as levothyroxine, Leotrix, and leothyronin. The action of this class of drugs is either to suppress an overreactive thyroid or to add synthetic thyroid hormones to a hypoactive thyroid. When used effectively, the therapeutic response to these drugs is euthyroid. Now let's talk about the pharmacodynamics of this drug class. Antithyroid agents PTU and methimazole work in the body by blocking the synthesis of T3 and T4. They have no action on existing hormones, they only block the synthesis of new hormones. Drugs such as levothyroxine work in the body just like endogenous thyroid hormones do by providing the negative feedback loop to decrease the secretion of TSH. Now let's talk about the pharmacokinetics of antithyroid drugs PTU and methimazole. Both of these drugs are metabolized very rapidly after oral administration. They are then metabolized completely in the liver and excreted in small amounts in the urine. They become concentrated in the thyroid gland, and they also can cross the placenta and breast milk. But methimazole crosses the placenta and breast milk at a much higher concentration than does PTU. The pharmacokinetics of thyroid replacement hormones are a little different. Levothyroxine is absorbed at about 48 to 79% following oral administration, while leothyronin is absorbed at about 95%. These circulating hormones then bind to serum proteins, and metabolism takes place when T4 is converted to T3 in the liver, kidneys, and other skeletal muscles. Excretion takes place through the feces via bile. Now that we've talked about the pharmacodynamics and pharmacokinetics of this drug class, let's talk about the pharmacotherapeutics. We'll start with antithyroid drugs. These drugs pose a risk for pregnant and lactating women because they cross the placenta and breast milk. Methimazole should never be used in the early stages of pregnancy as it's associated with birth defects. Adverse drug reactions include alopecia, agranulocytosis, aplastic anemia, and hepatic and renal failure. Drug interactions for this class include lithium and warfarin. PTU actually increases the effects of warfarin by antagonizing vitamin K. Now for thyroid hormone replacement drugs. These drugs can worsen cardiovascular disease, especially coronary artery disease, and are contraindicated in patients who have previously suffered from a myocardial infarction. Prescribers should be careful when prescribing to pre- and postmenopausal women, as they may suffer from decreased bone density and an increased risk for fractures. An overdose of these medications can cause hyperthyroidism. As far as drug interactions, drugs in this class work against warfarin, beta blockers, and digoxin. Also, bile acid sequestrants, antacids, and iron salts decrease the absorption of these drugs. So, when should we prescribe these drugs? Antithyroid drugs PTU and methimazole are used to treat hyperactive thyroid states in both Graves' disease and toxic goiter. Thyroid hormone therapy, such as levothyroxine and leothyronin, can be used to treat hypothyroid states from congenital hypothyroidism, Hashimoto's thyroiditis, and also in thyroid hormone suppression. When prescribing a drug, it's always important to remember cost effectiveness. As far as antithyroid drugs, PTU is the most cost effective. It's about 10% the price of methimazole. PTU is also the drug of choice for pregnant and lactating women because it crosses the placenta and breast milk the least. Levothyroxine is the thyroid hormone replacement drug of choice because it's easier to monitor, has the longest half-life, and is also cost-effective in generic forms. Monitoring these drugs is done with the goal of returning the patient to euthyroid. Thyroid function tests TSH, T3, and T4 are performed every 4 to 8 weeks until the patient reaches euthyroid. When educating a patient with Graves' disease, you need to let them know treatment will last 1 year. When educating patients who are taking levothyroxine, They need to understand to take their medicine first thing in the morning and on an empty stomach away from any other medications because it has many drug interactions. If your patient has a hypoactive thyroid, you need to put them on some Synthroid. Should be taken when they wake up, not with any pills they also take. Patients with Graves should have no fear. They'll be on medication for 1 year. No antithyroid drugs if you're having a baby, unless it's an emergency, then it's a maybe. Have treatment first before you conceive, then you can get pregnant, I do believe.